Okay. Start. Good morning, everybody. Today we are going to discuss the topic of physiology of phonation. This question is never asked in the exams, but due to completion of the syllabus, we are going to discuss this topic. Okay. So 2-3 points are asked in the PG entrance exam. We will highlight those points. But when it comes to the theory examination, this question is never asked, but it may be asked as 4 marks question. Okay. So we'll start with physiology of phonation. So students, you know what is the function of the larynx? What is the function of the larynx? The function of the larynx is production of the lower airways. How these lower airways are protected? The lower airways are protected by the cilia, which is present in the larynx, and by the mucus glands which are present in the cilia, which are present in the larynx. So this cilia will prevent the entry of the dust particles or entry of the foreign materials into the larynx by beating of the cilia. But in which conditions there will be a defect in the movement of the cilia? The defect in the movement of the cilia is seen in syndromes like cartilaginous syndrome. In cartilaginous syndrome, we will see that the cilia has absent dining rings. Because of this absent dining rings, there won't be any movement of the cilia. Not only that, this apart from the cartilaginous syndrome, we also have cystic fibrosis. In the cystic fibrosis, there is a defect in the chloride channel. So because of this, there will be thick secretions in the larynx. Apart from cartilaginous syndrome and cystic fibrosis, the other condition is smoking. What smoking will do? The smoking will hamper or will dampen the movement of the cilia. So because of all these conditions, there will be loss of protection of the lower airways from the cilia. Okay. Just apart from the protection of the lower airways, the other function is phonation and speech. This is a unique feature in the human beings because of the speech we are able to interact with each other, and I am able to tell class or I am able to speak some something before you because of the speech and phonation. Respiration contains inspiration and expiration, and respiration and inspiration and expiration are the functions of the larynx. Then what is fixation of the chest? Fixation of the chest is, if you want to lift weight from the ground, what we have to do? First, there will be inspiration of the air, and there will be fixing of the larynx and the chest wall. And because of this fixation of the chest wall, we are able to lift the weights from the ground, or we are able to lift some heavy weights or bags from the ground. So fixation of the chest is an important function of the larynx. Helps in promoting venous rhythm. See, in the cardiac cycle, in the heart, we have right chamber and left chamber. Right chamber will receive impure blood from superior vena cava and inferior vena cava, and the left side of the heart will receive the pure blood which comes from the 4 pulmonary veins into the left atrium. So the impure blood to the right heart comes from the venous system, that is from the superior vena cava and inferior vena cava. How it is coming from the legs? Due to contraction of the muscles in the legs, that is your muscles in the legs, this contraction of the muscles will push the blood into the veins, that is femoral vein and popliteal vein, and from there how it enters into the neck. It is because of the negative pressure generated in the thorax during inspiration. Because of this negative pressure, the venous blood is sucked into the neck or sucked into the superior vena, sucked into the inferior vena cava and enters into the heart. So these are all the functions of the larynx. The functions of the larynx is protection of the lower airways, phonation and speech, respiration, fixation of the chest, which is helpful for the lifting of the weights and helps in promoting the venous rhythm. Okay. So friends, please note down all these 5 points, because if they give 4 marks question, these 5 points are enough to write the 4 marks question or 2 marks question. And if they give 4 marks question regarding the mechanism of speech production, you write this all the 5 points and elaborate these points. And if you ask 2 marks question, these 5 points, mentioning these 5 points is enough. Okay. So what is the mechanism of speech production? The motor system. The lungs is associated with muscles that supply the air. The lungs is supplied by the intercostal muscles and extrinsic muscles and intercostal muscles, which and muscles of the diaphragm, which is helpful for the movement of the lungs. The vibrator. The vocal cord is a vibrator. The vocal cord is helpful. The movement of the vocal cords or mobility of the vocal cords produces the sound. So this vibrator of the larynx is nothing but your vocal cords. And how the pitch of the tone is changed, I already mentioned you. Due to movement of the cricothyroid muscle, the cricoid muscle is moved anteriorly and posteriorly, and because of the lengthening and shortening of the vocal cord, the pitch of the noise is changed. If the length of the vocal cord is increased, if the length of the vocal cord is increased, then the pitch of the sound will be higher. If the length of the vocal cord is shortened, then the pitch of the sound will be lower. So the pitch of the sound is maintained by lengthening and shortening of the vocal cord. So what is the vibrator of the larynx? The vibrator of the larynx is nothing but your vocal cord. So what are the resonator? The third one is the resonator. What is the resonator? The resonator contains your oral cavity, nasal cavity, pharynx, and the paranasal sinus. What is happening whenever the sound comes into these structures, like your paranasal sinuses, like your oral cavity, like your pharyngeal cavity, this sound will get vibrated. This sound will get vibrated, or this sound intensity will increase because of these resonators in the body, like your oral cavity or nose and paranasal sinuses. Then what is the articulators? See, the sound is produced by the larynx and it is amplified by your paranasal sinuses and your oral cavity. This sound will get converted into vowels or consonants. Okay, they are converted into vowels and consonants by the movement of your lips, by the movement of your tongue, by the movement of your soft palate, and by the movement of your lips, cheek. These all are the articulators which produces the vowels and consonants, which is helpful for the speech. Okay. Above all this, the important part in maintaining the speech is your brain. The brain contains the pre-central area, which is the motor area, which is helpful for the movement of all these muscles and the vocal cords. Okay. Already we have discussed about the extrinsic and intrinsic muscles of the larynx, and because of the pre-central area of the brain, which is helpful. This is the central circus of the brain. The central circus has pre-central area and post-central area. This pre-central area and the motor area will supply the muscles of the larynx, which is helpful for the movement of the muscles of the larynx, which produces the speech. So already we have discussed that same is repeated in this, the voice mechanism, the power source, which is nothing but your lungs. The vibrator is vocal cord. The resonator is your throat, nose, mouth, and the sinuses. And the articulators are the tongue, palate, cheeks, lips, and teeth. Okay. So please write down the theories of the phonation, because the theories of the phonation is asked as 2 marks question. So please write the names. The mechanisms is not important. The vibrating string theory, neurochronaxic theory, aerodynamic theory, and myeloelastic theory. So what are the theories of the phonation? The theories of the phonation are vibrating string theory. Okay, that means the vocal cords will vibrate like a string of a violin or string of a guitar. So vibrating string theory, neurochronotaxic theory, okay, aerodynamic theory, and myoelastic theory. Okay, so what myoelastic theory says, that means the vocal cord is like a elastic tense vocal fold vibrator. So this vocal cord, which is tense and elastic, it vibrates, which creates the sound, which is emitted out as voice. So this myeloelastic theory of vocal fold vibration is important theory and important mechanism for the physiology of phonation. So students, please note all these 4 theories, and for 2 marks question, if you mention these 4 theories, it is important. No need to elaborate it. If you want to elaborate the myoelastic theory of vocal cords, which states that the vocal fold vibration, which depends on the vibration of the vocal fold, depends on the elastic tension of the vocal cord. So because of this elastic tension, the sounds are produced, which are amplified by the paranasal sinus, oral cavity, and pharyngeal cavity, and which are modulated or which are converted into consonants and vowels by your lips, teeth, and tongue, and soft palate. Okay. So what is happening in physiology of phonation? Very important thing is during vibration of the vocal cords. Okay, first what will happen? First, there will be inspiration of the air. The person will take the inspired air into the lungs. Then what will happen? The vocal cord, glottis will close. I'll show it in the next figure. See, first there will be inspiratory mechanism. That means the patient will take the inspiration air, and after that the vocal cords are adducted. Adducted means the vocal cords will come near. All the muscles of the larynx are adductors except one, which is which muscle? Which is posterior cricoarytenoid muscle. So for phonation, the vocal cords must get adducted. After adduction means to come near. Adduction is different. Adduction to the alcohol is different. This is adduction, add. You're adding the vocal cords. The vocal cords are coming near. So when the vocal cords come near only, there will be phonation of the speech. If the vocal cords are far, or if there is any disease between this, if there is any disease between these two vocal cords, like your vocal polyps, vocal nodules, there won't be any vibration between the vocal cords. So for phonation, there must be adduction of the vocal cords, and the vocal cords must vibrate, creating a sound which comes out of the larynx. So first the step is there will be inspiration. Inspiration air will be below this adducted vocal cords, and it will be stored in the vocal cords. So there will be first adduction. First there will be inspiration. After inspiration, there will be adduction of the vocal cord, and there will be development of infraglottic pressure. What is infraglottis? Infraglottis is anything below the vocal cord. The larynx which is below the vocal cord is infraglottis. So there is generation of the infraglottic pressure. This infraglottic pressure causes vibration of the vocal cords. This is the mechanism of the phonation. So what is infraglottic pressure? The infraglottic air pressure is the pressure generated by the expired air. This infraglottic pressure will cause a pressure generation in the subglottic area, which causes movement of the vocal cords. Okay. So see this diagram. What is happening? This infraglottic pressure is causing movement of the vocal cords. From the separation of the vocal cords starts from lower inferior surface to superior surface. That means the separation will start like this. Just see this. This is the inferior part of the vocal cord. First inferior part will separate. Okay, then superior part will separate. So the separation of the vocal cords during phonation will start from the inferior part and it goes towards the superior part. This superior edge will separate later. First inferior part will separate, then superior part will separate. So separation of the vocal cords starts from the, see the diagram here. It starts from the inferior part, and last one, superior part, is still connected, and in the last phase the superior part also is get separated. So not only that, the vocal cords, see this is the vocal cord, think that this is the posterior, this is the anterior. The vocal cord separation also will start from the posterior to anterior. So think this is the posterior part of the vocal cords or posterior commissure, this is the anterior commissure, and the vocal cords also will separate from the posterior to anterior. Okay, so during phonation, the vocal cords will get separated from the inferior surface to the superior surface, and from the posterior surface to the anterior surface. So just remember, this is a very, very important point. You forget everything, you remember this one only. If you write this point, the physiology of phonation is over. So the vocal cord separation starts from the inferior part of the vocal cord, see here, and it continues up to the superior part of the vocal cord. Not only that, the vocal cord separates, this is the posterior part, posterior commissure, this is the anterior commissure. The vocal cord separation also will start from the posterior to the anterior. So this is the mechanism of physiology of phonation. So what happened? Now the sound is generated. This is not enough to create the good speech. Only a sound is created. Now this sound which is produced is vibrated, or it is amplified. Amplification has done by the oral cavity, by the paranasal sinus, by pharyngeal cavity. After the amplification, your tongue, your lips, tongue, soft palate, your lips, teeth, everything will act as a modulator. They convert this sound into a meaningful speech by creating consonants, by creating verbs, vowels, everything is created by this lips, tongues and teeth. So because of this, they are called as modulators of speech. So what are the consonants which are created by this modulator or articular surface of the tongue, teeth? See, this lips, bilabial lips will create the sounds P, B, M, W, and your labiodental or lower lip and upper teeth will create the alphabets F, B. Dental, the tongue makes contact with the upper teeth and it creates a sound O, and your alveoli, that is the tip of the tongue, makes contact with the alar ridge. This tip of the tongue will contact with the alar ridge and produce a sound like T, D, S, Z, N, L. And your palate, the tongue touches the palate and create the sound J, R, S, H. Okay. Next, glottal. This is generally an unvoiced vowel H. So unvoiced vowel H is produced by the glottis. Okay. So friends, now we have completed the physiology of phonation. So I have done a tracheostomy. What is tracheostomy? Tracheostomy is nothing but creating a artificial stoma or opening in the trachea. So what is trachea? Trachea is a continuation of the larynx. Up to lower part of the cricoid cartilage is your larynx. From the larynx, there will be starting of the trachea, which contains the tracheal rings. So if I keep a tracheostomy, tube, I will ask you one question. If I keep a tracheostomy tube, will the patient talk or not? Is he able to talk or not? Any answer? Can you give me any answer? After doing tracheostomy, can the patient speak? Okay. No answer yet? Okay, I'll answer to it. By keeping the tracheostomy, what you're doing, you're keeping the trachea below the vocal cords. So this expired air will go out of the tracheostomy tube. This expired air will go out of the tracheostomy tube. So there is no question that the air, there won't be any generation of the infraglottic pressure to vibrate these vocal cords. So once again, I am explaining, tracheostomy is done in the trachea. So this air, expired air, already I have told you that there must be some infraglottic pressure which is generated by the expired air to vibrate these vocal cords. But this expired air is going out of the trachea. Then what is the question? How can we generate a pressure, infraglottic pressure below the vocal cords to vibrate these vocal cords? So we cannot generate the vocal cords. Sound energy below the vocal cord because the sound is going out of the tracheostomy tube. But if the patient wants to talk, he can close the tracheostomy tube. He can close the tracheostomy tube so that the sound will vibrate the vocal cords. Okay. So what are the non-speech laryngeal functions? The non-speech laryngeal functions is the functions which are not associated with the speech. The larynx is helpful for protection of the airways. How it protects the airways? It is because of the presence of the vagus nerve. The vagus nerve has two branches. One is recurrent laryngeal nerve and another one is superior laryngeal nerve. Superior laryngeal nerve internal branch will supply above the vocal cord and recurrent laryngeal nerve will supply below the vocal cord. So any foreign body or any insect, any foreign body which enters into the larynx, this vagus nerve gets stimulated and it causes the coughing sensation which creates the outflow of the foreign body out of the larynx. So in a patient who is comatized, who is a comatized patient, this laryngeal reflexes are lost because there won't be any stimulation to the foreign body and this cough reflex is lost. Because of this gastric contents from the abdomen, from the stomach will enter into the larynx and it causes aspiration pneumonia. This syndrome is called as Mendelssohn syndrome. So Mendelssohn syndrome is nothing but aspiration pneumonia, which will lead to abscess, lung abscess. Okay. So some questions are asked regarding the artificial voice. So I am in the PG entrance exam. They have asked about this some valves and some artificial voice. So I have to mention. I will mention some points. So note down. So after total laryngectomy, what is total laryngectomy? We have removed the larynx, half of the larynx, up to where? Up to trachea. From the hyoid bone, that means from the epiglottis, if I remove up to the tracheal ring, first tracheal ring, it is called as total laryngectomy. Then I am bringing this trachea outside. This is called a stoma. So from the opening, the patient is able to breathe. So in which conditions we will do total laryngectomy? We will do total laryngectomy in the case of malignancies of the larynx. So in the malignancies of the larynx, we are removing the total larynx and we are keeping the trachea stoma outside, so the patient can breathe the air through the trachea directly. No use of larynx. You can directly breathe through the trachea. One disadvantage is the protective mechanism by the larynx. That is the protective mechanism by the larynx is lost because the larynx is totally removed and the trachea is left open. So in this condition, we are removing the total vocal cords. Both the vocal cords are removed. Then how the patient is able to speak? So there are some mechanisms by which the patient is able to speak in spite of removing of the larynx. That mechanisms are esophageal speech. That means the patient will use the esophagus for making the phonation. That how he makes the esophagus, the air he generates, he closes the mouth and nose and he generates the pressure in the esophagus. This esophagus will vibrate the pharynx and the patient is able to generate the sound, which may not be clear. But esophageal speech is one of the mechanism or one of the modality of speech after total laryngectomy. See, what is tracheoesophageal fistula? This also is done after total laryngectomy. That means a fistula is created between the trachea and the larynx, the trachea and the esophagus. That is, trachea is anterior and esophagus is posterior. Between this, we create a fistula. Because of this fistula, the expired air which comes out into the larynx will enter into the esophagus and it vibrates the esophagus, and this vibration will cause a speech. So tracheoesophageal fistula is also comes under the esophageal speech. So esophageal speech and tracheoesophageal fistula or tracheoesophageal puncture or tracheoesophageal processes is also one of the mechanism for creation of speech after total laryngectomy. So dear students, see a image. This is the larynx, this is the esophagus. So what I have done, I have removed the total larynx due to malignancy in the larynx. I have removed the total laryngectomy. Then we are left with the trachea only. Now I have created a fistula between the trachea and the esophagus. This is called as tracheoesophageal fistula or puncture. And through this fistula, I have placed a valve which is called as Bloom-Singer's valve. Through the tracheoesophageal fistula, I have created a valve which is called as Bloom-Singer valve. This Bloom-Singer valve is a one-way valve. What it will do, whatever the expired air it is coming, this enters into the valve, and through the valve it enters into the esophagus, and it vibrates the esophagus, which creates a sound and which are modulated by these lips, teeth and gums, and speech comes outside. Okay, so they have asked the question, Bloom-Singer's valve is used in which condition? Is it used in total laryngectomy? It is used in total pharyngectomy? Is it used in total thyroidectomy? Or it is used in cyst trunk operation? Cyst trunk operation we will do for thyroglossus cyst. We won't use any Bloom-Singer's valve in thyroglossus cyst. So the answer where we will use Bloom-Singer valve is total laryngectomy. In total laryngectomy, we remove the larynx, so we remove the vocal cords. So to create a speech, we have created a fistula between the larynx and the esophagus. This fistula, through this fistula, we have kept a processes which is called as Bloom-Singer voice processes. So this expired air enters through the Bloom-Singer voice process and it vibrates the pharyngeal surface, which it vibrates the pharynx, and or it vibrates the esophagus and produces a speech which is modulated and converted into consonants, vowels by these lips, teeth and gums. So they will ask the question, these are the mechanisms of generation of speech after total laryngectomy: esophageal speech, primary tracheoesophageal fistula, Bloom-Singer valve, none of the above, all of the above. The answer is all of them are useful for generation of speech after total laryngectomy. That is creation of tracheoesophageal puncture, keeping the Bloom-Singer process and esophageal speech. So friends, today we have discussed a topic which is never asked before, but we have to have a rough knowledge regarding the physiology of phonation, because it may be asked as a 4 marks question or 2 marks question. If they what are the probabilities they can ask as 4 marks question is they'll ask physiology of phonation. So no need to write everything. If you want a gold medal, you can write everything. But if you want to get a good marks, you can write only the mechanisms is, you can write, see the first one, mechanism of speech production, you can write the motor system, the vibratory mechanism, the resonators, which are nothing but lips, teeth and gums, and articulate, resonator is nothing but your oral cavity, nasal cavity, and paranasal sinus, and articulators are lip, tongue, teeth, and palate, and the initiators is nothing but the final master commander is nothing but your precentral area of brain, which is nothing but frontal area of the brain, which is helpful for the movement, which is helpful for the contraction of the laryngeal muscles. Then afterwards, you can write the theories. For 2 marks question, they will ask what are the theories. The theories of speech are vibrating string theory, neurochronotaxic theory, aerodynamic theory, and myeloelastic theory. And afterwards, you can write one point regarding the physiology of phonation, that the vibration of the vocal cords will generate the sound. So how the vibration of the vocal cord will occur? It is because of the generation of the infraglottic pressure, because of the expired air, and because of the movement of the vocal cords. The movement of the vocal cords or the opening of the vocal cords after adduction will start from posterior to anterior in this way, and it starts from inferior to superior. The separation will start from inferior. This is the separation will start from the inferior to the superior. So first inferior surface of the vocal cord separate, followed by the superior surface of the vocal cords. See, this is the image I'm going to show. So the infraglottic pressure is generated, which pushes the adducted vocal cords. So sound is generated. This generated sound is modulated by the lips, teeth, and gums. Okay. And in the PG entrance exams, they may ask about what are the artificial speech. The artificial speeches are esophageal speech, tracheoesophageal fistula, or tracheoesophageal puncture, and nothing but the last but not least, it is Bloom-Singer's valve, which is one-way valve. So finally, what are the functions of the larynx? The functions of the larynx is phonation and speech. It is helpful for the protection of the lower airways, that is your lungs. And the third one is, it is helpful for the fixation of the chest. If you want to lift any weights from the ground, first your chest must be fixed by the inspired air. After fixing the chest, you can remove the weights from the ground. So the patient who has tracheostomy, this fixation is not possible because the air will leak from the tracheostomy tube. So you cannot fix the chest by the inspired air. So the tracheostomy patient cannot speak. The tracheostomy patient cannot lift the weights from the ground. So these are all the functions of the larynx apart from breathing, that is apart from respiration, that is inspiration and expiration. These are all the mechanisms of, these are all the functions of the larynx. So friends, so we have completed a small topic. So everybody please utilize this time of Corona to study hard and to prepare for the PG entrance exams. You have already completed your first year anatomy, physiology, biochemistry, pathology, microbiology, pharmacology. So apart from studying the ENT, ophthalmology, and the SPM, you kindly concentrate on the entrance examination also. You go through the books, entrance books, and you try to solve the previous questions which are regarding the anatomy and physiology, so that you will come out with the flying colors. So friends, don't waste the time, okay? Because after completion of the MBBS, you have to get the good entrance exam. You have to complete your PG entrance examination, and you have to come out with flying colors. Stopping with MBBS will not give any credit to you, and it won't be any usefulness to you. So friends, don't waste the time. Okay, this is the right time to study well and to get the gold medal in ENT. So concentrate on the studies. Please don't waste your time. Okay, thank you one and all. Any doubts you can ask me. అయిపోయింది. డౌట్స్ అడగాలంటే మనం ఏమైనా ఆన్ చేయాలి వాళ్ళకి. ఒకసారి రా ఒకసారి. బాబు రా బాబు, హీరో వెయిటింగ్. డౌట్ అడగంటారు ఎలాగా అడుగుతున్నారా? అడిగారు క్వశ్చన్. ఇది ఎవరు ఇచ్చారు? ఆల్రెడీ ఇచ్చారా? ఏమడుగుతారు? ఎప్పుడు ఈరోజు అడిగింది లేదా? ఇంత క్లాస్ కా? ఏది ఎనీ డౌట్స్? If you have any doubts, please post it in the chat box. డౌట్స్ లేవుతున్నాయి కదా, మంచి ఇంటెలిజెంట్ స్టూడెంట్స్ ఉంటారు. డౌట్స్ ఉంటే ఎట్లా వచ్చి అడిగేస్తారు వాళ్ళు కాదు. రికార్డెడ్ ఎడిట్ చేసినట్టు చిప్స్ ఎక్కడ పెట్టారా డౌట్స్? MCQ. అంటే బెటర్ కదా.